I would like to invite our moderators. We've got Dr. Meeta Gupta and Dr. Anjali Miglani ma'am. We've also got our chairperson. We've got Dr. Monica Kolsch and Dr. Chaturbhuj Nayak sir. I request the moderators and the chairperson should please take this forward.
Very good evening, afternoon, evening to all our chairpersons, speakers, and all the delegates from across the world. Today, we are discussing on a very important topic, that is cancer management. As we all know, there are very limited RCTs in the cancer as far as homeopathy is concerned. So, we will have the opportunity to learn from our esteemed speakers. So without any delay, I would like to invite first speaker, Dr. Alok Parekh from India. He will be sharing his experiences in homeopathy in palliative oncology, a clinical perspective. Over to you, sir.
Thank you, madam. Uh, Good afternoon. The subject of my talk today is homeopathy in palliative oncology. Now, this is a subject which concerns us all. Yeah, this is a subject which concerns us all, and this is today a very big subject, and it's not possible to give everything in this short paper in a short time. I'll be very brief in my presentation. It's not moving, as it? I'll be very brief in my presentation. Cancer is a wide spectrum, and you find a wide variety of cases in cancer. But when you come to the lower end of the spectrum, that is when we are nearing the finishing the spectrum, cancer cases with multiple metastases, advanced cancer cases with multiple metastases and complications of modern therapies and surgery. And finally, the cases with recurrences who are left to die. That is the quality life issues. That is the cases below the white line. Now, these are the cases which really come under the domain of palliative oncology. Coming to the scenario of palliative oncology, what homeopathy has to say. Homeopathic fundamentals never change. Whatever may be the pathology, every cancer patient has to be individualized. And remember, I say again and again, we will never have a specific remedy for cancer. It is the individual response which is of the highest importance, and this is responsible for the best possible therapeutic results. Keeping this at the base, keeping this in the background, we move further and we find that we really have definite advantages in homeopathy treating these cases, because the fundamental law of cure in homeopathy is also the law of cure in palliation, where cure is not possible. It improves the quality of the life of the patient in totality, that is, including not only the physical sphere, but also the mental sphere and the spiritual sphere as well. And the administration of the similar remedy almost always brings about the best possible soothing amelioration. Remember, these are difficult cases to treat because the picture is dominated purely by pathology, and most of the time irreversible pathology. Hence, we find only few common symptoms. Symptoms like edema, symptoms like pain, symptoms like vomiting, symptoms like nausea. You have to prescribe on these common symptoms. And remember, the reactivity and vitality of these patients is at its very lowest ebb. So what to do now? It is very important in such patients when dealing in palliative oncology not to start with long-acting constitutional remedies, because the vitality of the patient is very low, the stage of the disease is very advanced with irreversible pathology, and the nature of the disease is organic. Such cases are not suitable for constitutional prescribing at the first go. And here comes Kent's first observation. Kent, a stalwart, said, and I quote, If a carefully selected antipsoric aggravates a low form of disease and the aggravation is protracted and no amelioration of the condition follow, no more antipsoric should be thought of for that patient. The hope of cure must be abandoned and short-acting medicine resort to palliate. And he especially says in cancer and organic diseases of this kind, this rule holds good. He further adds, and I quote from his chapter on Carbo Animalis, we do not want to teach, nor do we wish you to have infer that a patient with a well-advanced cancerous affection may be resort to perfect health. We may comfort and resort order at least temporarily. So what does that mean? Here comes the importance of organotropic remedies in palliative oncology. And I talk a lot about these organ remedies. This will need a bigger time. So today I'll be very short and give you a glimpse of our approach in this problematic oncological cases. The organ remedies are a great help in stabilizing and achieving the stage where constitutional treatment, if possible, could be used in future. We often find in these remedies similarity to the pathological symptoms, similarity to the common symptoms. And one of the great homeopaths has said, in these advanced cases, the pathological symptoms are as important as the finer shades of symptom in the beginning. So you have to take the pathological symptoms into consideration. These cancer remedies, which have evolved at our center and in my practice of last 4 decades, I would be sharing with you, but in a very brief manner. We use these remedies in lower potencies because we are dealing at the cellular level, at the tissue level, at the pathological level. This list of remedies that has evolved from our center of advanced cancers need further additions and pooling from all clinicians, from my colleagues, Dr. Spinedi, Dr. Farooq Master, they are here. And they would agree with me that we need more and more pooling, mutual pooling to add further to this list. Majority of these remedies are clinical and they need further provings. They are best used in drop doses of the mother tinctures, lower potencies like D6, C6, and up to 30C. This is just a glimpse of some of the remedies. I will not go into the detail here. For example, cadmium sulf, a grand remedy for cancer of the stomach, but also a grand remedy for side effects of modern cancer therapies, the chemotherapies. Calendula, a simple homeopathic herb for offensive discharges of open cancers, a great healing agent. And it is said that it gives oxygen to the cancer tissues to heal themselves. Cholesterinum for cancer of the liver. So I will not give you, go into the details of all the remedies. Hydrastis, a grand remedy for cancers of the gastrointestinal tract and the liver and the biliary ducts. A grand remedy to improve immunity in cancer. Kali cinatum, a grand remedy for agonizing pains of cancer of the stomach. Creosotum for foul-smelling cancers, cancers of the cervix, of the stomach, and for the vomiting of cancers, a grand remedy. Moving further of the list, you find so many remedies here. Ornithogallum, a grand remedy for advanced cancer of the stomach and intestines, especially cecum. Sempervivum tactorum, a grand remedy for ulcerating cancer of the tongue, for healing of the ulcers of the tongue. So these are the remedies with very few and common symptomatology, and they need further proving. And I've been using them at my clinic with success, and very soon you will get a large work in a book form with you. This is just a glimpse. For example, carbo animalis. We all know this is a big remedy, this is a deep acting remedy, but how it works in palliative, how does it do soothing palliations in advanced cancers? Now look at this ulcer. This is located on the supraorbital and frontal region on the right side of this old man. This is a cancerous ulcers with irregular hardened tissues. Looks bluish red in appearance. Now, this bluish red in appearance is because of the venosity, the veins prominent. It has marked burning and offensive discharges. So you see irregular jagged ulcer, not bleeding so much like active bleeding like acid nitric or like phosphorus or millefolium. Quite, but very painful and looks cancerous on the face of it. Another example of carbo animalis, a cancer of the scalp. You see, the bone has been eaten away, irregular, zigzagged, and with redness, pinkishness, very foul smell, marked burning, and very painful. This is typical carbo animalis. X-ray, a remedy which we must use more often. A remedy which has a marked effect on the bone marrow, on the lymphatic system, and a grand remedy in post-radiotherapy cases. A remedy for fibrosis and dryness in the post-radiotherapy cases of oral cancers. Kundurango, a grand remedy in cancers of the epithelial structures, especially where mucous membrane joins with the skin, corners of the lips, wings of the nose, the anal verge, and inside in the esophagus, in the breast, in the stomach. This is a grand remedy. Gallium aparine, a grand remedy for cancer of the tongue. We have many remedies for cancer of the tongue, but this is to show you the clinical picture, the pathological picture of the tissue. There's a nodulated tumor on the tongue. Here you see a nodulated tumor on the lateral margin of the right side of the tongue. It soon gets ulcerated. When this cancer gets ulcerated, starts bleeding, and becomes very painful, we have a remedy called kali cyanatum. So gallium is before kali cyanatum. Gallium does not have that much pain, which kali cyanatum has. So this was just an example I wanted to give you. Asterias rubens, a grand remedy for advanced cancers, for the palliative work in advanced cancers of the breast, open cancers, ulcerating cancers, foul-smelling, discharging cancers. There is a metastasis to the axilla. The axillary nodes become knotted and hard and fixed. There is a metastasis to the bones of the chest, to the ribs, to the scapula, and severe pain, shooting pain radiating to the scapula. This is more for the left-sided breast. This was just to give you a little imaging of these wonderful small clinical remedies doing wonderful work in palliative oncology. I just give you a glimpse of a small case, a glimpse.
是咪 中文？
How much time? So,
No, sir, we have 10 minutes.
Okay.
We have, yeah.
Okay, well, because there was no counter on my screen. So,
Oh, sorry, you're not able to see that. There are 10 minutes remaining. We're just trying to assign the Chinese interpreter. That's all.
okay. Emergency case, I'll just give you a glimpse. We will not go into the detail. A middle-aged man was seen in the outpatient as a follow-up of carcinoma left buccal mucosa. This was an advanced case who had had surgery, who had had the chemotherapies, and he came to us when the whole cheek was eaten away and there was a metastasis to the neck. The neck glands were swollen and ulcerating, a very fearful condition to look at. Now, these ulcerating lesions looked septic, gangrenous, with a tinge of black blood and a very foul odor. And above all, the general condition of the patient was very, very ill, a very ill nourished patient to look at. Anemic, in a septic state, so he had fever with chill. This patient, see, this you often find in palliative oncology. The patient many times are not in a position to give any modalities or any definite symptoms. This patient could not talk. This patient could not sit. The only thing he said was, I am suffering with great pain and burning. Now look at the condition. This is what you get many times in practice. See, the patient has had therapies, the patient's had surgery, was better, again recurrence to the neck, and now finally you find a septic state. This septic state is now all over the body. The patient is toxic physically and very dull mentally. And he's not able to give you any symptom. Only thing is the pathetic state you look at and what you do. There is no time for a constitutional remedy. There's no time for a big remedy. And we often get this in the outpatient. This patient gave us these symptoms: marked pain, severe burning, fever with chill. He could not eat or swallow anything. And so he was very ill-nourished. And he was so weak that he could not even sit or talk. Now, this was the clinical remedy prescribed on clinical presentation, anthraxinum C30 twice daily. He was also advised a supportive, proper hydration and nourishment, could be through the intravenous routes or through the tubation. So you see in these patients, an accessory medical help to save the life of the patient is very important, and homeopathy is not against it. Other remedies that were considered for this case was anthraxinum, arsenic album, carbolic acid, echinacea, a great antiseptic with us, lachesis, pyrogenium, and Tarantula cubensis, the great spider. We selected anthraxinum because of the severe burning and toxicity and ulceration and pain. And this helped the patient. After 4 days, patient was able to sit, although very weak, could not talk, but was able to sit. And this was also because he was supplemented by some fluids and nourishment. We further followed him with anthraxinum 30, and he showed marked improvement. The quality of life improved. His suffering was lessened. And we followed this patient for further 4 months. And we were very satisfied. This was very satisfying. Later, we did not hear much from him. I'm not sure what happened because this was an incurable case. But these are the wonderful remedies in such states we have. To go further into anthraxinum, its pathological presentations, horribly offensive ulcerations. These are gangrenous ulcers with marked burning, burning much greater than arsenic and phosphorus, burning much greater than sulfur. Now, this burning is a malignant burning. You see, the anthraxinum burning is a malignant burning. I would say it is a last stage burning. And for the open skin conditions, malignancies, we know this remedy very well. A grand remedy in palliative oncology for such types of patients is carbolic acid. Ulcers with offensive odor, as offensive as anthraxinum. But here, you see, intensely bad smell from the mouth. You cannot sit near the patient. He has such a bad smell from the mouth, and with that, The smell for the patient is very acute. He cannot tolerate any smell and he can smell anything. So we have the acutest smell in carbolic acid. And in these palliative oncological patients, there's a marked increased olfactory sensibility. That is a grand feature of this remedy. Another remedy very near in this case would have been pyrogenium. As Alan says, this is our dynamic antiseptic. And sepsis is in the entire essence of this remedy. A remedy for bacterial poisoning, a remedy for cancerous poisoning, a remedy in septic fevers, where there is fever with very rapid pulse out of proportion to temperature. So you see these septic cases, they respond very well to these remedies. A little glimpse into another remedy, Cistus canadensis. Now, this remedy has a great affinity for the neck. Metastasis to the neck. You often find neck as a very important place which attracts metastasis. So cancer of the liver with metastasis to the neck, cancer of the lungs with metastasis to the neck, cancer of the esophagus with metastasis to the neck. Now, these metastatic nodes in the neck respond very well to Cistus canadensis. The potencies that I normally use is C6 and C30, and I repeat it. These glands also get suppurated. They start bleeding. But in this case, Cistus was not given because of the septicity which Anthraxinum had more. It has an spongy feeling in the throat, and the swellings of the neck are so much that even the head is drawn to one side, hard fixed swellings. And many times it's an important remedy in Hodgkin's diseases. So dear friends, this was a very, very quick and short brief I could give you, but I would very soon provide you with a big book of our work on this. Palliative oncology has today greatly evolved in homeopathic clinics. Sound documentation is the need of the hour to bring this effective alternative option to the forefront. Now, the thing that I always say is that these patients are very pathetic. We should be very sympathetic to these patients. We should cooperate with other available options. We should have a composite therapy for the best of these patients and for the benefit of the patient. But we should also document these cases scientifically. Scientifically means we should work in cooperation with our colleagues in oncology. We should give them data, the clinical data. We should work with cancer markers and the imaging to show the homeopathic result. We just can't do this, but we must document it clinically and give them the homeopathic scenario and homeopathic part of it. And I think that is very important in the oncological world today. Thank you very much, my dear friends, for your patient hearing. Thank you.
Thank you, sir, for such an interesting talk. We are looking forward to your book. Thanks a lot. May I now welcome the next speaker, Dr. Dario Spinetti. He'll be talking on the integration of homeopathy in the health system with a special focus on oncology.
Dr. Spenedy, could you start your screen sharing? Yes, we can see it, sir.
It's
You
okay.
can, yes.
You see my presentation?
Yes, sir.
Excuse a moment, I have a little problem. Okay. Thank you very much for your invitation and giving me the possibility to speak about my topic, dialogue and synergy homeopathy in integrative medicine. Over the course of the 25 years, 10 colleagues in our clinic have provided homeopathic care to hundreds of patients with cancer. I would like to speak as a practitioner for practitioners. How to research at the bedside using practical cases and how to incorporate the research results after repeated review into the modern healthcare system. Follow-up study of a patient with metastatic breast cancer, then results based on the observation of this case. Third, other possibilities of synergy and summary. The 34-year-old patient visited me in 1989, exactly 33 years ago, for severe pain from a pulmonary embolism, which disappeared completely on sepia Q3. This was a selective one-time treatment. She was not given any other remedy. In 2000, 11 years later, she consulted me for a diagnosis of mammary carcinoma in the right breast. The patient was given phosphorus Q3 up to Q9 after a long case taking, under which the onset of a vertebral metastasis occurred with severe, very severe pain. Diagnosis: multiple spinal metastasis from right breast carcinoma. Phosphorus was consequently not the correct anti-cancer remedy. Now the patient was given chemotherapy, radiation, and an operation to straighten the vertebral fracture, and also phosphorus Q10 up to Q27 because of the side effect symptoms, which pointed to phosphorus, with the result that there were very few side effects from the chemotherapy. The primary tumor regressed completely and the spinal pain was reduced to a minimum. Later, symptoms of conium appeared, which was prescribed as Q3 up to Q9. All the patient's complaints disappeared completely. After these prescriptions, the symptoms of the original remedy appeared, sepia, which also had a very good effect. Sepia was first given as Q potency and then according to Kent scale. Sepia and conium had to be given alternately, always according to the symptoms. Follow-up 22 years. The patient does not have the tumor up to now. In this case, we were able to see once again with all clarity that phosphorus, which had not shown any favorable effect on its own, was able to unfold its full power together with chemotherapy and radiotherapy. This again proves a specific effect of phosphorus during chemo and radiotherapy. In the course of the cure, however, the symptoms of conium came out, which was a correct remedy for the breast cancer. This patient reported on careful inquiry that she had put on a very tight camphor bandage when breastfeeding, so that the milk would go back. She had been in a lot of pain for 3 days, but the nurse said it had to be that way for the milk to disappear. It is understood that this injury to the breast laid the seed for the later development of carcinoma, which requires conium as a major glandular injury agent. After the removal of the conium energy in the body, the symptoms of the original constitutional remedy sepia appear to finally cure the underlying miasm. At the same time, however, I would like to note that I have always had to give conium as an intermediate remedy as soon as the appropriate symptoms appeared. This proves that sometimes we have to give the right cancer remedy for a long time until there is a definitive cure. Here you have a follow-up, phosphorus, conium, sepia. You can see the alternance of sepia and conium. Here during the year, we have more sepia, then conium again. She takes all the time tamoxifen and faslodex. Conium, sepia, conium. with long intervals, conium here mostly, then sepia again, conium, phosphorus, conium, sepia, radium bromatum, sepia, radium bromatum again. This silicea was not a good prescription. Conium, radium bromatum, sepia. Radium bromatum because of the symptoms of this remedy. Here again, conium, sepia, phosphorus, phosphorus, sepia, radium bromatum, phosphorus because of phosphorus symptoms. And all this until the present, this year, 2021. Now the remarks. Until today, the patient has been treated with this remedies in alternation. One remedy was only prescribed when the complaints came back. The prescriptions were always based on the law of similars. These complaints always disappeared after the remedy was given. Carcinoma cases require long-term treatment. Now, what have we learned from this case? Here we have different points. Point A, the role of phosphorus. About 70% of the patients who come to us receive the remedy phosphorus in a first phase during chemotherapy and radiotherapy. The remaining 30% receive, based on the frequency, arsenicum album, nux vomica, radium bromatum, X-ray, cadmium sulfuricum, and others. Once the role of phosphorus in biochemistry is understood, it will be even easier to grasp why this agent plays a prominent role in all energy-consuming processes. Cancer, radiotherapy, and chemotherapy are also specifically among these extraordinarily energy-consuming processes. The energy balance of the cell, the mitochondria deserve our special attention due to the abundance of phosphorus compounds in the consideration of phosphorus metabolism. They have rightly been called the energy central of the cell. ATP is a universal energy carrier. You see everywhere the phosphor atom. The energy-producing processes in the mitochondria as a prerequisite for all highly energy-demanding processes in the organism. The oxidative stress. Imagine the energy consumption the body is confronted with during chemotherapy. Destruction of many healthy cells, which then have to be repaired and synthesized again. In the process, the creation of billions of free radicals. The oxidative stress, the creation of billions of radicals, which must also be neutralized via energy-consuming processes. The same applies to radioactive exposure of the body, for example, in the case of nuclear fallout, Chernobyl, atomic experiments, or radiotherapy. In this situation, phosphorus is often life-saving. This is our experience after 23 years, now 25 years of clinical work on tumors, patients, and is one of the most important areas in which the synergy with conventional medicine is most expressed. In this context also, secondary neoplasm after chemo and radiotherapy. Long-term observations carried out within the framework of the Hodgkin disease late effects project of the Society for Pediatric Oncology and Hematology in Germany over a period of almost 22 years show that a total of 11% of former patients after combined chemo and radiotherapy were affected by such a secondary tumor within the mentioned period. In addition, the following case, the seven-year-old boy came to us because of a recurrence of a rhabdomyosarcoma in the small pelvis, which had grown back to a volume of 500 milliliter. Within 3 months, despite the use of all the possibilities of conventional medicine, chemotherapy, radiotherapy, surgery. According to the specialist, the prognosis for such a recurrence was very poor. In Germany, only one child had survived a recurrence of a rhabdomyosarcoma. Start of homeopathic therapy in 1999 with phosphorus in Q potencies. At that time, another radiation treatment and chemotherapy were administered. The rhabdomyosarcoma was cured. The child, who in the meantime has become a young man, has been free of recurrence and has continued to be treated mainly with phosphorus. Observation 23 years. Practically none of the side effects of the radiation that the specialist has predicted, necrosis of the femoral head, irritation of the intestine with diarrhea, growth disorders were observed. It is very important to treat these children parallel to homeopathy because they will suffer from fewer side effects from radiation and chemotherapy. The leukocytes recover faster, experienced several times. One can save on medication. You treat the patient as a whole so that the relapses are less. The late complication of chemotherapy and radiotherapy can also be greatly reduced. The quality of life is much better. See Freiburg study made in our clinic. DNA as a carrier of hereditary substance. Phosphorus participates in the structure of the nucleotides. Through the phospholipid, especially lecithin and cephalins, which are involved in the construction of many interfaces and cell membranes. Therefore, importance of phosphorus in the treatment of benign and malignant brain tumors, especially after chemotherapy and radiotherapy. The phosphoric acid ester of the monosaccharides are highly important in the breakdown of carbohydrate in the organism. One of the most important compounds of this type is intermediate metabolism is glucose 6-phosphate. Importance of phosphorus in the treatments of diabetes, diabetic retinopathy especially. Together with calcium, phosphorus is significantly involved in bone formation, hence its prominent role in the treatment of bone tumors, especially malignant, osteosarcoma, etc. Now we have all the point of the importance of phosphorus, energy balance, oxidative stress, chemo and radiotherapy, oncological pediatrics, prophylaxis for late radiation damage, participation in the construction of genetic material, structure of cell membranes and brain substance, importance in sugar metabolism, importance in bone metabolism. The second point, the assessment of the Q potencies in the course. Why did the spine collapse? Because too little attention was paid to the symptoms that appeared during the course of the cure. Namely, a few days after starting the therapy with phosphorus Q3, the patient developed the following symptom: a cold foot on one side. This symptom lasted only for 1 day. If one had taken the symptom into account with a symptom of breast cancer, one would have quickly understood that conium was a needed remedy. In our case, a symptom occurred under the effect of phosphorus, which the patient described as new, a cold foot on one side. We were deceived by the fact that the patient was otherwise very well, better energy, better appearance, etc., and stayed on phosphorus. It was the early days of working in the clinic where experience of the accuracy of Hahnemann's observation was still lacking. The role of the placebo exists. Experience has taught us in the meantime that we must look less at what makes us better and more at the things that disturb us. If you look at the corresponding rubric on unilateral cold foods, there is no mention of phosphorus. One can therefore clearly exclude this remedy in this case, according to Hahnemann's indication in the organ on sex edition. New symptoms that the patient has never observed appear after administration of the given remedy. In this case, the remedy is not correct. These new symptoms are often very important to find the new correct remedy. The Q potencies. Definition of Hahnemann's Q potencies. By Q potencies, we mean the 50,000th potencies, Hahnemann's last discovery in Paris and described in the Organon. After 23 years of clinical work on oncological patients with the Q potencies, we can confirm all of Hahnemann's observations. This gives a cure and almost mathematical certainty. The Q potency have proven to be the best form of administration in the clinic over the last 23 years. For patients receiving chemo and radiotherapy, the remedy is given daily as a Q potency along with the chemo radiotherapy. In this way, the side effects can be greatly reduced. Patients with advanced conditions can avoid the initial worsening of the condition. Great advantages: one can give the organism a continuous therapeutic impulse without homeopathic aggravation, and thus greatly reduce the toxic effect of chemo and radiotherapy. Disadvantages: many therapies don't know the exact rules how to administer Q potencies, according to Hahnemann. The C potencies according to Kent, the Kent scale. Here we have the scale of Kent with a minimum duration of dynamization for chronic cases. Each dynamization is prescribed twice before moving on to the next one, then start again from the bottom. When to use C and when to use Q potencies. In our clinic, the treatment of oncological cases, the Q potencies are indispensable to carry out clear cures and to interpret the reaction that occur. When there are no larger macroscopic tumors in the body, and when the chemotherapy and radiotherapy are finished, we then move from the Q to the C potencies according to Kent. Injury consequences. In our case, this suppression of the milk flow with a tight, painful bandage laid the seed for this later carcinoma. Conium is a very important remedy for injuries to the glands, breast, testicle, pancreas, but also to the lungs and bones. We have observed several times that after very painful mammograms, existing tumors on the breast have just grown explosively. But any kind of trauma, a blow from a tennis ball or a small child hitting the head on the chest, metal parts of breasts that always press on the same spot, etc., can trigger a tumor at this very spot. In other parts of the body, other means come into question, as the following cases proves. In these cases, we can also work synergistically with conventional medical therapy by using very specific remedies for the consequences of the injury. Multiple states coexisting and the alternance of remedies. In our case, we find several conditions side by side. The basic constitution, sepia, through the injury, a second condition grafted itself onto the basic constitution, conium, through chemo and especially radiotherapy, a third disease enters the body, phosphorus and radium bromatum. In this case, it is necessary to produce an exact list of the symptoms that lead us to sepia, conium, phosphorus. When the corresponding symptoms appear, the indicated remedy is given according to the similar law. Here we have the symptoms of conium. Here we have the symptom of sepia. Now, anti-hormones. The administration of anti-hormones can cause symptoms which are alleviated by corresponding homeopathic remedies that have an effect on the hormonal system. For example, hot flashes or other complaints, such remedies as sepia, conium, but other remedies too. Radium bromatum. Sometimes symptoms of troublesome localized or generalized rheumatism occur in irradiated patients with the symptoms of rhus toxicodendron. Heat improves, continued exercise improves. In these cases, radium bromatum is indicated. The synergy with conventional medicine is clearly expressed by the administration of these remedies by improving the quality of life of the patient without disturbing the effect of the conventional therapy. Continuous antidoting of the radiation sequelae. In the course of the cure, the body from time to time produces bronchitis or sinusitis or dizziness with the symptoms of phosphorus. The deeper meaning of this acute episode is that the body still wants some phosphorus to antidote the later effects of the rays. This all contributes to fewer relapses, see late effects of radiation and chemotherapy. Another very valuable synergy with conventional medicine. The law of similar, like cures like, means that the disease is cured with a remedy whose test symptoms on the healthy person are the same as those of the disease one wants to cure, provided one prescribes this remedy in a dynamized form. in therapeutic action that results in a clear guideline according to which principles the remedies are to be administered. Long-term care for tumor patients. An old gynecologist told me almost 35 years ago that cancer is a sleeping lion and sooner or later it will rear its head. With homeopathy, we have the possibility to treat with appropriate remedies when the corresponding symptoms appear in order to avoid relapses. So, what could we learn from this case history? You see, we have treated all these points one by one. So, this is our research in everyday life. Hahnemann said, the only oracle of truth is a sickbed. Now, as a possibility of synergy and summary, where can homeopathy and conventional medicine work synergistically in the interest of the oncological patient without interfering with each other? First, antidote to the side effect of chemotherapy and radiotherapy without weakening their effects. Oncologists who work with us are satisfied with the cooperation. Preventing the occurrence of late damage due to radiation and chemotherapy, especially in oncopediatrics. Homeopathy knows remedies that works specifically when traumas are significantly involved in the tumor process. Prevent amputation in some cases. Reducing the side effects of many medications, opiates, painkillers, antihormones, interferon, etc., without weakening their effect. Strengthening the overall constitution of the patient and thus improving the prognosis. See also studies by Professor Frass at the University of Vienna. Palliative oncology. With this work, I wanted to show how bedside research can be done on each individual case to gain deeper insights and how these findings can be integrated into the modern healthcare system in the interest of the patients after many years of repeated observations. In the short time available, I could only show certain aspects of homeopathy in the care of oncological patients. We always have to keep in mind that every patient and therefore every therapy is different. Thank you for the possibility to present my paper, and thank you to the other colleagues I work on the oncology, and especially Dr. Parekh. He brought the kind to treat in India, where you have a lot of poor people with very advanced cases. In Europe, we have the problem with chemotherapy and radiotherapy. Therefore, I find we are complementary working. Thank you very much.
I thank you very much, Dr. Daria Spinetti. May I talk?
Please.
Okay. I thank you very much for your inspiring work, and I also want to mention that Dr. Alok Parekh is his work is really great, and I'm really happy that we can find ways for helping so suffering patients, and we have a way to help them, and I would be glad if the authorities make us more, let us more work together. Thank you.
Thank you.
We also have Dr. Michael Frass with us. Can I request Dr. Monica to please invite our next speaker?
Thank you. Dr. Michael Frass, thank you for joining us, and thank you for your presentation, what you are going to give us, the effectiveness of the additive homeopathy and clinical research. I think this is a very important work and shows how deep how it can goes along with the conventional medicine and the homeopathy, and I think through your work will be encouraged. So please start. Thank you.
So, thank you so much for the invitation. I always enjoy to be in touch with India and with international colleagues. So, some years ago, I tried now to forward my chat, but for some reason it will not continue. Okay, some years ago, I did some visits to India, delivering some lectures.
Apologies, sir, but the presentation is not seen. It's still in the edit mode. If you could put it in the slideshow mode first and then start the screen sharing.
I should make it smaller or
Big, basically, because we are able to only see the edit mode. You can edit it.
I try to change the size, but I'm not sure.
Okay. Can I ask you, are you able to see the whole screen, your presentation? The full screen is your presentation, is that true?
Yes.
But over here on Zoom, we can only see the window. So to do that, first we have to stop your screen sharing.
Yes.
Now, I kindly request you to go to your Windows button. If you can press the Windows button, go on the Zoom app. Once you are on the Zoom app, you could press the green, but again, we are able to see only the edit mode. So we are not able to see the full screen mode. So we can see your notes also, sir.
Yes. I try. I just, again, I open the screen. And I make a new.
Yes, perfect, sir. We can see you're in Jaipur.
Is now okay?
Yes, yes, sir, perfect.
Okay. So I enjoyed being in Jaipur some years ago. And then I just want to continue, but the screen does not continue now. For some reason, I cannot. Okay, now we also did some workshops with the CombiTube. You know, this is a device for securing the airways and oxygenating a patient during resuscitation. And now going back to the General Hospital of Vienna, the Medical University of Vienna, where I have worked up to 2 years ago in the Red Tower. And during the last 15 years, I was running an outpatient unit, which was in the area of the Department of Internal Medicine 1, Division of Oncology. And cancer patients were treated conventionally with chemotherapy, radiation, and surgery. And those of patients who were interested, optional, could also ask for additional homeopathy. So there were about 600 patients contacts per year in this outpatient unit. And we did a study evaluating survival data of cancer patients with advanced stages of cancers, utilizing additive homeopathy. And we found that if a patient was treated up to the 6 or even up to the 12 months after diagnosis with homeopathy, this makes this leads to longer survivals in those patients. So the interpretation was that patients who were still alive after 6 months or even 12 months after diagnosis have a survival advantage if they already have a homeopathic additive therapy at this point of time. Now we did a study. It was an open pragmatic trial. There was no placebo in the control group. And we mostly used Q potencies with increased potencies starting with Q1. So we were influenced by Dario Spinedi and his co-workers. And we also used the C and LM potencies. The homeopathic remedies or medicinal products, as they are called now, they are prepared according to the European Pharmacopoeia and the homeopathic pharmacopoeia. So we used twinkle Q potencies, and as you know, so there are quantitative applications of 2.5 milliliter dilutions onto 50,000 globules. The first iteration goes until CH3, then the dilution and succussion was performed. And it was Hahnemann's last discovery when he was working in Paris. Those potencies have a very mild influence on the patient. And we have the feelings that there's a quicker healing by frequent repetition of the same remedy with almost no side effects to the patient. Now it was Ilse Mujic, pharmacist in Vienna, who has prepared those remedies. And this second publication in the field of oncology was evaluating the influence of additive classical homeopathy on the global health status and subjective well-being in cancer patients. This was a pragmatic randomized controlled trial. The objective was to evaluate whether individualized homeopathic treatment taken as an adjunct to reference treatment could affect the quality of life and well-being of patients with several different types of cancer. The methodology was evaluation of quality of life via a questionnaire, the internationally used EORTC QLQ-C30 questionnaire. So it was a randomized study, and we found a significant improvement in quality of life and well-being of patients receiving individualized homeopathic treatment. And we also compared the retrospective study, which we have used in the medical center, which showed that homeopathic treatment can also significantly influence patients' survival. Now, going back to this pragmatic study, it was an open label study. There was no placebo used in the control group, and evaluation was done in patients with different types of cancer, so there was a big heterogeneity of the groups. And the other one, the first study, was a retrospective assessment of patient survival. So we continued to look at the results of this study. The global health status and subjective well-being were improved. Also, all the functional parameters, as well as fatigue, pain, dyspnea, only diarrhea worsened in the homeopathy group. In the second column, you look to the control group, and you find that subjective well-being was improved, while physical function was deteriorating. The whole functioning was improving. There was a worsening of nausea and vomiting, and also of constipation, appetite loss, and diarrhea. Now, when we compared the changes between the third and the baseline evaluation in the homeopathy group versus the control group, we found that homeopathy was doing much better than in the control group with regard to the global health status, to the subjective well-being, and also all functioning parameters improved when compared to the control group. In addition, fatigue, also pain, dyspnea, and appetite loss were improved. Now, the good thing is that there was a equal distribution between with regard to the patient's characteristics and also with regard to the types of cancer and also with regard to the different types of conventional treatment. Those were the remedies mostly used in those patients, and surprisingly, and I hope Darius Benedi will be happy, phosphor was #1 used in those patients. We were also very happy that this study was included into the German S3 guideline, which is an evidence level 2B for homeopathy. And this guideline is used for complementary medicine during treatment of oncological patients. So I think this was some very important improvement of this guideline. Now we are looking to the last study, homeopathy, in patients with non-small cell lung cancer. And we were looking whether homeopathic treatment as an add-on therapy might improve quality of life or even prolong survival in patients with non-small cell lung cancer. And this was a prospective randomized placebo-controlled double-blind multi-center study. And it was published in the conventional journal, The Oncologist. The methodology was that it was a phase 3 prospective study with double-blind randomization. It was performed multicentric within 4 cancer centers within Austria. Inclusion criteria were patients with advanced stages of non-small cell lung cancer. It was stages 3B, 3C, and stage 4. Patients had to be diagnosed within 8 weeks before start of homeopathic additive therapy. I think this is one of the features which were different or even more precise than in most conventional studies. And patients had to be under chemotherapy. Now, the objective was to assess the impact of homeopathic treatments taken in addition to conventional treatments in those patients with advanced stages of lung cancer. And the primary endpoint was patients' quality of life. And the secondary endpoint was patient survival. With regard to quality of life, it was a double-blind study, randomized and controlled, and it included patients with advanced stages of non-small cell lung cancers. Altogether, 150 patients with advanced type of lung cancer were included into this study. 51 patients were found in the homeopathy group versus 47 patients in the placebo group. The 51 patients received conventional treatment plus individualized homeopathic treatments, while the 47 patients received conventional treatment plus placebo globules, neutral pellets. So altogether, 98 patients were included into the randomization process and compared on a double-blind basis. And there was evaluation of quality of life and survival. Now, since there's always a discussion whether the placebo effect might be overruled even by a subjective effect of the homeopaths, we also created a control group. Those were 52 patients who denied participating in this study, but they allowed that their course of disease was evaluated. So these 52 patients received conventional treatment alone, but no homeopathic treatment at all. And they, of course, did not fill out any questionnaires. Now, the evaluation of patients' quality of life was done by 2 questionnaires. They were filled in at study entry and then during the 9th and 18th week. And the 2 questionnaires were the well-known EORTC QLQ-C30 questionnaire, which is specializing on the quality of life of cancer patients, and the SF36 questionnaire, short form 36. It is a generic and standardized questionnaire evaluating patients' quality of life with all types of pathology. Now, with regard to the results of the primary endpoint, the 10 parameters out of 14 improved within 9 weeks, while 14 parameters improved within a period of 18 weeks. So there was an improvement in most parameters at 9 weeks, and both evaluations were significant. Now, here you can see the different life quality as well as function scales after 9 and 18 weeks, and you see that there was a significant improvement. The same can be found, or similar findings were seen in the symptom scales after 9 and 18 weeks, which also improved in the homeopathy group when compared to the placebo group. And if you look to the primary endpoint, evaluating the patient's quality of life, and if you're focusing on the examples of symptoms impairing quality of life, you see that there was a significant improvement for various symptoms in the homeopathy group versus placebo group. Here you can see pain, nausea, fatigue, appetite loss, insomnia. Now, even more surprising was that the median survival time in the homeopathy group was significantly improved versus placebo group. The median survival time was 435 days in the homeopathy group versus 257 days in the placebo group. And there was also a significant difference to the control group with a median survival time of 228 days. And the time was significantly longer. So this was one of the special results of this study. And if you compare, there was about an improvement of 6 months of the homeopathy group versus placebo group, and about 7 months versus the control group. So even if you look to the Kaplan-Meier curve, you can see that there's an improvement with homeopathy group. It's the blue line versus placebo group is the red line, and control group is the green line. And you see that there's a survival rate after 2 years in the homeopathy group is twice that of the placebo group and 3 times that of the control group. So I think this is a very nice improvement. Now, the survival results could be explained by an improvement of the quality of life, because if you look to a paper which has evaluated quality of life with regard to survival in a meta-analysis done some years ago, it was found that improvement of quality of life also improves survival time. And in addition, there was a better observance of conventional treatments by alleviating side effects. So a study of the specific activity of homeopathic treatment would be warranted. And now I just want to show you something. I think it's very important. There was a publication 4 years ago in Austria, and at the Technical University, the interesting explanation was found with regard to a single atom americium, which is a radioactive substance. And this single atom is able to change the crystallization behavior of hundreds of millions of terbium atoms. So just keep in mind, one single atom may influence hundreds of millions of terbium atoms. And the heavy rare earth terbium now behaves like a light rare earth and subtly crystallizes. And this might be of importance for the handling and safe long times storage of nuclear waste from the production of nuclear energy. So I think this is just the lowest level to be investigated, and this might also make it reasonable that homeopathy is working with such small amounts. Now, in conclusion, homeopathic treatment additively used in cancer patients might help to better tolerate the side effects of disease and the treatment by significantly reducing some of the symptoms. It helps to improve quality of life in cancer patients, and it leads to extend the time of survival, and this under better conditions. So I think these results confirm the results of the previously performed study, the MITIC study from 2015, which reveals the benefits of homeopathy and the quality of life of patients suffering from various types of cancer. So as a take-home message, I think that previous publications and observations, as well as studies, suggest that additive homeopathic treatment in oncological patients makes sense. Thank you for your attention.
Thank you very much, Michael, for your very good presentation. This encouraged us a lot to work on to make patients not to wait until they have no chance, just to start by to combine conventional medicine with homeopathy. Thank you very much.
Thank you so much.
So still time a little bit left, isn't it?
Yes, ma'am. But if we have the next speaker ready, we can move forward as well.
So is the next speaker ready? Dr. Farag Master?
He's with us. Yes, he is.
He is? Okay, so I send my greetings. Can I talk?
Yes, please, ma'am. Yes, you can.
Okay, so I'm sorry. I think it depends on your account, because when you're talking, every time is funny noises in to hear. So it's not my fault. I'm very quiet here. So Dr. Farag Masses, I'm happy to welcome you here on the LMHI a global colloquium. We are very happy that you are going to give us a short view of the next theme, what you have. So you will talk about your personal experiences with glioblastoma. So thank you very much. Go ahead and let us take part of your knowledge. Thank you.
So, good evening, everybody. And thank you for Liga for giving me an opportunity to present work. I'm running a palliative oncology department in KEM Hospital since more than a decade. And on an average, we see about 50 to 60 new cases in a month with advanced cancer. And I have selected this time cases of glioblastoma, our experiences of how to manage the patients who suffer from glioblastoma multiforme. So let us start our presentation. So the main medicine that we have used in almost all cases of our glioblastoma is temozolomide in 9C potency to begin with, and then we went on to higher potency of temozolomide. Now the main reason why we included this medicine was that in the beginning we started treating patients purely on symptom similarity and selecting one remedy to begin with, whatever the remedy comes according to the matching with the materia medica, proving and the patient's symptom. But many times we were disappointed that the patient feels much better in symptoms, but the pathology increases. And that was a very disappointing thing for me to know. Subsequently, I was influenced by the works of Dr. Crompton Burnett, who started using many pathological remedy along with the constitutional remedy to tackle the cases of advanced pathology. And so in case not respond to a single remedy, we started using pathological remedy along with the constitutional remedy. But even in that methodology, many times we were not able to reduce the size of the tumor, even though the patient started improving wonderfully well with the symptoms. So we were experimenting with different pathological remedy, and then it came to our mind that since temozolomide is a very important chemotherapeutic agent to treat glioblastoma, why not use this medicine in the patient in a potentized form in a dynamic way for glioblastoma cases? So let us see what happens next. So primary brain tumor are those that arise in the brain itself, and they account for 1% of all cancers. Many of these tumors may be malignant and will account for approximately 2% of all cancer-related deaths. These are some of the pictures which I'm showing you of our glioblastoma patients. The most commonly occur in the 5th and the 6th decades of life, but the second most common form of cancer in childhood next to leukemia. Even though the textbook mentions 5th and the 6th decades, but we have seen glioblastoma in young people also in 20s and 30s. Tumor arising from other parts of the body may metastasize to the brain, and these most commonly come from cancers of lung, breast, kidney, and skin. Metastatic tumors of the brain are usually multiple. So this is one such picture which I am showing you, where a patient presented with a multiple metastasis in the brain and how we tackle the condition. So the methodology. So using modern chemotherapeutic drugs in potentized form. Now here I am only going to discuss temozolomide, but honestly I am using many chemotherapeutic drugs in my practice in a potentized form to fight this particular situation. But in this study, we have only used temozolomide. Based on symptom similarity, cases were selected that were operated partially and the tumor could not be removed, or it was in the area where the operation was impossible, or patient was partially operated and then again the recurrence comes back. So these are the type of cases that we took in our study. All the patients were confirmed by brain MRI, which was repeated every 6 months to judge the progress of the condition. Now, again, I just want to stress that here I am not going to look much at how the patient was feeling, but that was definitely yes. But our main focus was reducing the size of the tumor, reducing the bulk of the tumor, or debulking the tumor. So that was the main aim of using temozolomide. Response assessment in neuro-oncological criteria was purely done on RANO, also known as response assessment criteria for glioblastoma, was used to evaluate the response. So this is the RANO criteria, where you see measurement on the left-hand side, progression, response, durability of response, definition of measurability, and on the right-hand side, you will see RECIST, McDonald, and RANO, the 3 main types where you can use this as an important criteria for every patient when it comes for follow-up. Exactly what is your observation, number of target lesions. So you have to see on the left-hand side, up to 5 non-specified, something like that. T2 flare, corticosteroids considered, clinical status considered, and pseudo-progression considered. So this is the response assessment in neuro-oncology. This is a must if you are going to do any glioblastoma studies. The observation period was for 2 years. Temozolomide in 9C potency was given 3 times a day for 3 days a week for several months. Now, this is very important. As Dr. Dario Spinelli said, that in cases of cancer, you have to repeat the dose frequently and you have to continue the treatment for a very long time. And I endorse this because this was what we also did till there was a reduction in the measurement of the glioma. During homeopathic treatment, no other allopathic treatment, chemotherapeutic drugs were used. So that is also very important. So they were all used in the past. Patient was operated, treated, chemotherapy was given, radiotherapy was given, but in the past. But when we were doing the study, we never used this. So here now I am going to give you a model case from the study. The rest of the cases that we treated were exactly on the similar pattern. So let us have a look. From 2018 to 2020, in about 2 years, 50 patients have been observed under temozolomide 9C, and 60% of the patient had regression in their residual tumor. So I will show you how. Conclusion: homeopathic potencies of chemotherapeutic temozolomide 9C over a prolonged period have helped regress the residual tumor in 60% of the patients. This is temozolomide. In cases of cancer of the brain where patient experiences nausea and vomiting. Now, this was one of the clinical proving that we did of temozolomide. And the most important symptom that we saw was nausea and vomiting associated with glioblastoma. Flushing of the face, that was a second symptom. Persistent constipation and dark black stool. So these are some of the clinical symptoms which we repeatedly confirmed in the patient who responded to temozolomide. So you can say indirect clinical proving. Other noteworthy symptoms were dizziness and problem with balancing, inability to eat and drink, blurred vision. That was very important. Almost all the patients that we treated with temozolomide had a blurred vision. So definitely the lesion has to be somewhere near optic nerve or somewhere near optic chiasma. And some patient had convulsion with extreme fatigue. So these are some of our observation on temozolomide. The homeopathic remedy that was very closely related to temozolomide was Artemisia vulgaris, naphthalene, and sulfonal. So many times when we saw a case of temozolomide, we also had a similar symptom that could be seen in Artemisia vulgaris, naphthalene, and sulfonal. So let me show you a case in example since I have got only 25 minutes to present my work. So this was a case of thalamic pilomyxoid astrocytoma operated in the beginning, but actually it was a case of glioblastoma when the biopsy was done. So biopsy and MRI showed glioblastoma, but the doctors in the beginning thought it was an astrocytoma. 19-year-old patient consulted 13th July, blurred vision, residual tumor, symptoms related to increased intracranial tension and fluctuating blood pressure. So these were the main symptoms in 2018. As I've told you that we are only going to see cases between 2018 to 2020. So the whole problem came in 2014 with blurred vision, difficulty in focusing, and develop into mild hydrocephalus with bilateral ventricles. So you will see that in the beginning he had ballooning of the ventricles, hydrocephalus, and blurring of the margins of the calyx. You can see over here, or the fornix. Underwent endoscopic third ventriculostomy, and they diagnosed in the beginning as a tumor, which was 2.1 by 2.2 by 2.1, underwent right frontoparietal craniotomy, decompression in 2014, underwent radiotherapy. And you can see on the right-hand side, still there is a residual tumor remaining. Even after decompressing the tumor with surgery and radiotherapy, the results were not totally satisfactory. In fact, neurosurgeon had warned that there is no guarantee for the tumor not growing back. Now, glioblastomas are known to grow back. This resulted in a huge anxiety and fear of recurrence and fear of getting blind with poor vision, because the vision of the boy was very badly affected. So here is the histopathology report, which showed right thalamic pilomyxoid glioblastoma grade 2. And post-operative MRI brain dated July 18 suggested 3 by 4 by 3 by 3 by 2.6 centimeter. He is also a known case of hypertension, and the presenting symptom was blurred vision, constipation since childhood, weakness on exertion, and headache on fasting. Now, we never gave temozolomide immediately on the first visit. Please remember that. We always allow constitutional treatment in the very beginning and see if the case improves or not. Only when the case is standstill or the size of the tumor does not regress, we start using temozolomide. Appetite is diminished, thirst is adequate. So the case taking is just like any other case taking. Love for sweets, aversion to pumpkin, frequency of urine at night, stools are constipated, sweat on forehead, thermally is ambithermal, sleeps on sides, sound sleep, past history of falciparum malaria at the age of 3 years, mild hydrocephalus which was decompressed 1 month before the tumor was operated, and recurrent bilateral renal calculi. And I think so from there, the renal calculi, the hypertension also started. Mother has hypertension, father has hypertension and diabetes, 2 things together. Born and brought up in Jabalpur, never had any stress or any crisis during childhood. Very attached to the mother, will always help people in need. Caring and emotional, has stage fright, gets frightened before going on to stage for any performance. And that was the only symptom available at that particular time. Now remember, in an advanced situation of cancer, advanced cases, as the pathology increases, the peculiar cure symptoms becomes less and less. Every one of us know that. So like Dr. Spinedi and Dr. Alok Parekh both had mentioned this, that if you look at their totality of symptoms also in advanced cancer, it is just a few important pathological symptoms. So anticipation, stage fright, hydrocephalus, fasting, pain in the head, tumor of the brain, blurred vision, constipation, difficult stool, urination frequent night, sleeps on side, hypertension, weakness, exertion. Now, we never had that rubric of glioblastoma at that time in the repertory, so we had taken astrocytoma over here. And this is what it comes. The Dr. Spinedi is talking about phosphorus and sepia. Look over here. Phosphorus is number 5, sepia is number 2. Calcarea carb is number 1. What should I do? So I selected Gelsemium 30 for 30 days. I usually give 5-cup method. Those of you who don't know the 5-cup method, it is the plussing method of Hahnemann, which is little modified. You can look in the YouTube. There is a video of 5-cup method. 1 teaspoonful twice a day for 30 days. Now, along with that, every cancer patient that we see, we give this Indian herb, Terminalia chebula, in 1x potency. Those of you who don't know the effect of Terminalia chebula, please Google it out. It's a very useful Indian herb. It is like a nutrition to the patient. We give it in 1x potency, and we give 10 drops in half cup of water 2 times a day. Now the tumor was very close to the optic chiasma, and it was compressing the optic chiasma as a leader, as a reason that the vision was becoming blur and blur and blur. Now in such situation, we usually give iodium mother tincture. So Farrington had mentioned to reduce the pressure on the chiasma and the vision getting blurred, we usually give iodium in a mother tincture form. So that was also given 10 drops in half cup of water 2 times a day. So that was the first prescription. On 10th of August, blurring vision is reduced for majority of the days. unable to focus on distance object, weakness on exertion, headache on fasting, and tinea comes up in the groin area. So in a very first follow-up, you will see a psoric symptom coming in a psychotic pathology, which is a very good sign. And this could have been suppressed in the past, his tinea, we don't know. It came up. And normally when skin disease comes up, we don't treat that, we just leave it alone because we know that it will go away on its own unless it comes in a very severe way. So it was ignored. Same prescription was given for 2 months because we have a hospital in Bombay, but patient comes from Jabalpur, so it's very far. So we usually used to give 1 month or 2 months medication to the patient. So for 60 days, the same prescription, Terminalia 1X, Iodium Q, and Gelsemium 30. So after 2 months, we did MRI of the brain, and it is said comparison to previous MRI dated July, mild decrease in the size of enhancing tumor, showing post-treatment central necrosis. Now, this particular MRI department and in the hospital, they don't acknowledge homeopathy as one of the treatment. So the improvement that they are trying to show over here in the beginning is because of the necrosis of the tumor. And see, there is a central necrosis which is happening to the patient. We started in July and September, the MRI shows like this. Blurring is better, tinea has gone away, focusing is better. Same pathology, Gelsemium 30 for 60 days. Same prescription, we are not changing it.
Зависло.
I believe we have lost connection, and he seems to be back though. Happens. Let's give it 10 more seconds. If not, then we could move to our next speaker. So yes, I believe we have dropped out. We've got Dr. Elio Rossi with us. Can I request the moderator to please invite our next speaker, Dr. Elio Rossi?
Yes, please. I can do I will welcome Elio Rossi from Italy. He will join us and give us a look at his work due to public health in oncology by integrative medicine. So please, Elio, start.
Yes, thank you very much to you and to the organization for inviting me, and together with all these important master we have heard before. Very quickly, what is the situation of the use of integrative medicine for cancer patient in our region in Tuscany? Is about 38 of people working with cancer using a complementary medicine. 66% of them are informing their oncologist, and 90% experience the benefits of this. All our story, I have a sort of two words of introduction. My presentation is divided in 2 parts. One is what we have done in our regional situation to build up a system of integration of complementary medicine, acupuncture, herbal medicine, homeopathy, of course, within the mainstream. And the second, the experience of our clinic for cancer patients in the public hospital of Lucca. And a great part of this work was made because of our participation as a Tuscany region in this joint action, European Partnership for Action Against Cancer, finished in 2014, was our duty was, our goal was to look for evidence of complementary medicine in cancer patients. This is a book we published some years ago in 2015. And then is mapping the European reality of cancer institution providing complementary medicine to their cancer patient. And we discovered that around 20% of these more than 200 institutions are providing complementary medicine. Which kind of complementary medicine? Mainly acupuncture, but you can see if we put together homeopathy and homotoxicology and also anthroposophic medicine in German-speaking countries, we have the main majority of centers providing this kind of homeopathy as in complementary medicine. But mainly they are using so-called in Italy biotherapies, which are different kind of therapies not provided by medical doctors. Just to mention this important, interesting meeting we made in 2017, we supported the Tuscany region, was a meeting trying to see the possibility to help the problem of refugees in the Mediterranean area, and that we organized a meeting for nurses. Was made this meeting in Haifa 3 years ago, and supported also from regional funds of Tuscany. This is the group of nurses working there. And other important European initiative was participated to the initiative of breast cancer made by European Commission. And this is the group of work, and you see IME there has expert of complementary medicine, was the first time in this kind of work. And this is the conclusion, the work in which was stated in the manual for breast cancer service that every kind of breast cancer service must have a written policy to ask to the patient for complementary medicine. But in Tuscany, we started more than 10 years ago to work with the oncologists, conventional oncologists. There are two networks. One is the network of oncologists, and the other the network of integrative medicine, regional network. And we started to review the literature on the use of complementary medicine in cancer care. This is the document we realized at the end of the work. But after that, we start to work together, and we have a part of the participation to this European project, the book, published the book. We had a act in 2015, we speak about, which speak about complementary medicine inclusion and integration in the oncology network of the region. This is a flyer, a brochure, to give to all the cancer patient coming to the oncological department of the region, in which there is some explication of what to use and also what not to use in integrative medicine. We appear as the integrative medicine for oncological patient, also in the website of the conventional tumors institute, conventional therapy for cancer patient website. The name is ISPRO, is Institute for Study Prevention and the Oncological Network. There is also a center that tries to study the possible interference between complementary medicine, special phytotherapy, herbal medicine, and conventional anti-cancer treatment. We have a journal that is arrived to 8 years of publication, and this is, you can see here, 2 numbers about cancer patient and cancer treatment. We had also at the end of 2018 a call for research, and we had €1 million at disposition, and 3 projects about complementary medicine in integrative oncology won this call, and the one was our clinic for a project about to treat with complementary medicine, so-called chemobrain, the cognitive impairment after chemotherapy, endocrinal and radiotherapy for cancer patient. This is a group, we support a national group for integrative oncology. This is a book recently published, Principle of Integrative Oncology. Everybody, every discipline say what is possible to do with different discipline in oncology. This is the flyer, the poster of two congress. You can see that they are both supported by Tuscany region, one in 2016, the other in 2018. Then there was pandemic and the COVID pandemic, and there was a finish. When to use complementary medicine, we have all the step of what is the pathway of a cancer patient, since the primary care, screening to the diagnosis, treatment, supportive care, follow-up, but also we have seen before palliative care, end of life. Two levels of treatment. One is made also for nurses, not medical doctors, but healthcare work professional, giving some advice or using some like auriculotherapy or some advice for also remedy like arnica, for instance, for surgical intervention. The second level is the expert visit for cancer patient. This is kind of protocols we are using, arnica before treatment, before surgery, then some using of some remedies for flashes of heat in iatrogenic menopause, and also a protocol to use radium bromatum before and after belladonna or other remedy according to the symptom for radiotherapy. In this moment, we have about 19 integrative oncology clinic, public integrative oncology clinic in the regional healthcare system. What means public health system service? Means that people are coming freely. They don't have to pay anything for the visit, and also is free auto payment the cycle of acupuncture session, which are 4, 8, 12, depends of the condition of the patient. And this is the situation of our clinics, practically are spread all around the region, in all the hospitals of the region. And this is what we spoke before, the resolution 2015, in which practically the region compromise to take in account integrative oncology, to make it at disposition of the patient, and to develop clinical research on this. Then the region approved a decree, was in 2021, about breast cancer, in which many part of them there was integrated medicine visit at the side of a radiotherapeutic visit or oncological visit. And the last just arrived a decree was integrative medicine for cancer patient, in which the region put that a patient is referred to acupuncture, phytotherapy, and homeopathy by the multidisciplinary oncological group in relation to the control of possible side effect of the chosen therapy. And this is the annex to the decree, in which and the list of oncologists and experts of complementary medicines, the group working group. And this is on your side, right, the image of the work, which all the professionals of the multi-group are in the side by side around the patient, and with the collaboration of the patient. Why oncology, integrative oncology must be included? We have seen before, because efficacy, but also because it's possible to reduce side effect of cancer treatment, and allowed an exchange between a professional, and then it can enrich each other. And this is our experience in Lucca. This is a tower, Guinigi Tower, a symbol of Lucca with olive trees in the top of the tower. We have in our area 5 centers of integrative oncology in all the main cities of our area, Tuscany Northwest. And these are the area of interest of our clinic. One of most important is oncology. The items, the goals of our clinic is to reduce adverse effect of anti-cancer treatment and to ameliorate the quality of life of the patient, also providing some advice about the diet to the patient. We are including in the breast unit of the hospital. We are part of the breast unit. This is a little book that is given to all the cancer patients, in which there is also the chapter of complementary medicine. We participate every month in a meeting among patients, a new diagnosed with breast cancer patient, with the multi-group, oncological multi-group, which is on the your side, the right, in the lower side. This is a course of healthy cooking. This is our patient with the oncologist. And what is the working, the schema? That people is coming from an oncology department, but they can also have a direct access. They have not to pay the visit. They meet me as expert of complementary medicine and homeopathy in particular, and an oncologist. And then there is a prescription, the follow-up visit, but also the patient can be referred back to the oncologist or to the acupuncture clinic for specific symptoms. This is a kind of advice we advise to the patient how to reduce or avoid raffinate carbohydrate, white sugar, meat, especially red meat, to prefer fish, and also to use whole grain and curcuma, pepper, ginger, some of spice that are used, and to prefer to consume sesame, cruciferous like cabbage and broccoli, things, mixed berries, what to avoid, what to reduce, and what to prefer. This is the idea. This is a flyer that we give to all the patients. In our clinic, we use a wind chip to take as an informatic clinical record, and also radar like repertorization. We have seen till today about 6,000 of patients, 6,600 of patients, and of them till today are about 750 the cancer patients seen till today. Generally, they are female, 86%, with the mean age of 57 years old. And they are coming generally not asking for alternative treatment, but integrative treatment. Mainly we see breast cancer, colon, lung, ovaries, and uterus, and that they are not first cancer, but they can be 10% or more second cancer or cancer relapse. And they use 7% of them are using also at the side of homeopathy, with homeopathy also acupuncture, and 30% have already metastasis. And this is the effects of chemotherapy, radiotherapy, etc., that make the motivation of the request of the visit, 60% to reduce the effect of anti-cancer treatment, 26% for symptom of cancer, but also important, 11% for comorbidities. And these are the comorbidities according to the different kind of anti-cancer treatment or cancer symptoms. You see asthenia is the most important symptoms, but hot flashes for endocrinal therapy. There are the two acupuncturists working with us, Dr. Anna Elia and Chiara Menicalli. And these are the symptoms in which we have statistical significance, advantage result, hot flashes, nausea, constipation, asthenia, anxiety, depression, insomnia, and general status of the patient. These, you see the main used treatments are in phosphorus, as you have seen by the lesson of Dr. Spinedi, and curcuma as in integrative herbal therapy. This is the protocol I showed before. We give generally for the patient that are coming for radiotherapy, radium bromatum before, and then belladonna generally, and then calendula to reduce the local inflammation, radiodermitis. We evaluate retrospectively some patients for toxicity criteria of radiation therapy using this RTOG, radiation therapy oncology, which is a validated system to evaluate. And we have seen in particular a group of 73 patients, one group 39 with the homeopathic integrative protocol, the other one control group. And we have seen in this control group, in this group treated with homeopathic integrative, a very good result with 35 patients with this had practically no severe result of radiotherapy, TOG G0 or G1, and very few with the G2 or G3, and just one with G4, the main toxicity. But the control group, we have opposite, only 13 patients with G0 and G1, and the other with a much important level of radiodermitis. You can see in the graphic the situation. In gray there is control, there is a homeopathic group, the other dark is black dark is the control group, and that is a significant effect. And also we have done this some result publishing some work on reviewed, peer-reviewed magazines, journals. The most important is this of 2018 in Journal of Alternative Complementary Medicine. And well, the conclusion is the integration of evidence-based complementary treatment, in particular with homeopathy, as a part of comprehensive cancer care network, allows to respond effectively and safely to the demand of cancer patients and combine safety and equity of access in public health system. This is the group working in our clinic of these people. There are 9 people, and these are all the group mixed oncologist and complementary medicine expert. Thank you for your attention.
Thank you, sir.
Thank you very much for your presentation. So, are you talking? I'm not sure who's talking now.
Ma'am, now it's we hand over to the chairpersons for their comments.
Okay.
Just wanted to also let you know, Dr. Farooq Master has joined us back. In case, can we just have some closing remarks, because he had dropped out. If he is available, can we give him a few minutes with respect to the time, and of course we do have some time. The moderators, is that okay?
Yeah, that is fine, please.
Okay, so I'm sorry the internet connection went off when I was out of it. So we did another video, another MRI brain scan in the 1st of November. And this particular showed that there is no significant change in the size from the last MRI. However, the edema is little less. So the second MRI was not very encouraging, because after the first reduction in the size, after 2 months, there was not enough reduction, but just a little reduction in the edema and the masked effect of the brain tumor. So what should we do? Continue gelsemium and the same protocol. So normally when these things happen, I allow person to go and continue one more repeat cycle to see if we can still further improve the size of the tumor. So everything same was given: Terminalia, 1x iodium mother tincture. In March 2019, now we are going to the next year, blurring is better, focusing is better, episode of headaches on and off, and mild cough. Again, you will see same thing, that the old symptoms are coming back of his cough and cold, but not much. I'm not showing the video because I'm little afraid that the internet may not be so friendly. Today we have a very poor connection in Bombay. Anyway, let's see if we can show you. इंटरनेट में कनेक्शन भी खराब हो गया, which was a very dark. अभी दूसरे पे जाओ, next case पे जाओ. So we took another MRI in the month of February 2019, and that showed further decrease in the size of the tumor. So this was a very encouraging report, as I said. Now it's very difficult to differentiate when the report comes good and when the report does not come good. Sometimes we are very sure that the size will reduce and we get disappointed, but sometimes when we are not so sure and the report comes very good. So same place we did the MRI, it showed further regression. So this was in the, as you can see with the previous thing, MRI dated 26 February 19 in comparison with 1st November 18, mild decrease in the size of the lesion, which is important. So gelsemium, and now for the first time, we dropped away Terminalia and we dropped away iodium mother tincture because iodium had played the role. We don't repeat iodium mother tincture, we stop it. And since the decrease was not happening very fast, because it's almost a year, and that is the time we introduced temozolomide. So the entry of temozolomide in glioblastoma studies in my hospital is only when the tumor has stopped responding or it is responding very slowly. So we give it from Friday to Sunday, 1 teaspoonful twice a day. So 3 days in a week he takes that. The rest of the days he takes gelsemium. That was the protocol which we had decided. In the month of April, 100% improvement in the vision after temozolomide, mild cough on and off. temozolomide for another 2 months till the tumor became totally disappeared from the brain. I want to show more PowerPoints, but unfortunately, again, we are having problem with the internet and I cannot move my PowerPoint forward. So in the month of May, as you can see, vision improved 100%. Episode of headache on and off. Eye accommodation is much better. Again, the person develops skin eruptions in between the thigh, but we don't have to treat that. So gelsemium was continued Monday to Thursday and temozolomide from Friday to Sunday. This time we gave medicine for 3 months. And in the September, that is exactly after 1.5 years, everything was better. Then he develops a major attack of cough and cold, which needed an intervention with nose obstruction, sneezing, discharge, cough. So we took a very small totality of discharge from the nose and throat mucus and the evening cough. And this was the repertorial totality. And then we gave lachesis to the patient for a few days till the respiratory episode totally disappeared. Then again we went back to gelsemium, followed by temozolomide, and we continued that protocol.
I think we are facing issues again with the internet. So in the meanwhile, can I request the moderator to now sum it up and give the concluding remarks?
Can I speak something?
No,
Yes, sir.
please. We have to actually ask Dr. Chaturbhuj Naik sir to give his comments on
Yes.
each of the
Sure,
presenters.
sure,
His
sure.
comments are very valuable, and so as the other chairperson.
Yes,
Dr.
yes.
Mohan.
And don't forget, today we have to take a screenshot with all the speakers. We are very happy to be part of one big session. So we shall be taking a picture together. So be camera ready in some time. Over to Dr. Bhuj and Dr. Naik.
Yes, good evening. At the outset, I must convey my extreme gratitude to the organizers for allowing me to chair to be co-chair, and I must profoundly appreciate the valuable deliberations of our esteemed speakers on various facets of cancer management through homeopathy. I'll just summarize quickly. Dr. Alok Parikh talked about his methodology of palliative oncology by individualized and organ remedies in treatment of cancer patients, which improved quality of life and lifespan of cancer patients besides relieving their sufferings. He also shared a group of homeopathic medicines effective in managing cancer patients. Dr. Darius Pinedi stated his success in treating 2 cancer patients, one suffering from metastatic breast cancer and the other suffering from rhabdomyosarcoma pelvis. And the intervention was homeopathy with radiotherapy and chemotherapy. And the results were life of the patient was prolonged. Coming to Dr. Michael Frass, he presented his published research papers on treatment of cancer patients with homeopathy as additive to conventional medicine. He also presented a randomized control trial showing effects of homeopathy as adjuvant to conventional therapy in patients suffering from non-small cell lung cancer. The results were statistically significant in terms of 2 endpoints, that is quality of life and survival period of cancer patients. Dr. Farooq J. Master adopted a protopathic approach for treating glioblastoma cases. He prescribed potentized form of chemotherapeutic drug, that is temozolomide, in different potencies starting from 9 centesimal. In majority of cases, he observed the regression of tumors. Besides, he also presented other cases treated with different other homeopathic medicines. And the last speaker, Dr. Elio Rossi, presented how multidisciplinary treatment, including complementary medicine and homeopathy, was given to the patients in cancer departments of Tuscan public healthcare in Italy. The objectives were to provide effective, safe, and quality treatment to cancer patients, to reduce bad effects of anti-cancer drugs, and the prolong the lifespan of the patients. So at the end, I must admit that the valuable presentations, the success stories presented by your speakers today will definitely benefit the homeopathic fraternity, including the research scholars, the teachers, students, and the clinicians. Thank you very much. Jai Homeopathy, Jai Hanuman.
Thank you, sir. May I also request Dr. Monica to please give her comments?
Thank you, Dr. Nayak. He already talked, everybody what I could talk, so I just say it was very, we heard very encouraging speeches of the combined therapy of homeopathy and conventional therapy, and I thank all speakers. They were all inspiring, and I thank you for the work and that they join us with LMHI.
Thank you, ma'am. Just to add, we have received a very overwhelming response on our WhatsApp groups regarding this particular session, and everybody feels that this session has been very informative, especially very much thanks to our speakers. Can we have a group photograph, please?
Requesting all to please switch on the camera. Dr. Nayak?
Yes.
Yes. All of you smile. 3, 2, 1, and thank you so much. With this, we conclude this session, and the next session is going to get started in exactly 20 minutes from now. Thank you so much for being there. Thank you so much for being on time and for making this session a grand success. Thank you so much again.
Thanks to all speakers and chairpersons. Thank you.
Thank you.